But those super popular weight loss drugs like Wegovy, they've been proven to be extremely effective, but for many, the price puts them out of reach. And now some are turning to cheaper copycat versions. But are they safe? Stephanie Gosk reports.
In this office park on Long Island, pharmacists are producing one of the hottest commodities on earth. Not popular weight loss drugs Wegovy or Zepbound, but medications they say are, in FDA terms, essentially a copy.
What does essential copy mean?
Well, the formulation actually comes from the manufacturer. It's in the package insert.
It's a recipe.
It's a recipe.
That recipe mixed at hundreds of compounding pharmacies like this one nationwide, using ingredients purchased from FDA-registered manufacturers.
So and this is semaglutide powder?
This is semaglutide powder. This is exactly what it looks like.
How are you allowed to do that if there is a patent on these drugs?
The FDA allows for this. If a patient needs the medication and it's on shortage, the only way they're going to be able to get it is to come to a compounding pharmacy and let the pharmacy make it for them.
It's a little understood part of the multi-billion-dollar weight loss drug industry. Federal law allows state-licensed compounding pharmacies to dispense drugs that are essentially a copy of FDA-approved medications, only to patients with a prescription and only for medications in shortage, which includes Wegovy and Zepbound. Compounding pharmacies often sell them at a steep discount, usually $100 to $400 per month, compared to roughly $1,000 for the name brands without insurance. Elizabeth Kenley needed to lose 50 pounds for a double knee replacement. She struggled to find the brand-name drugs in stock and at a price she could afford.
How are you doing?
So her primary care provider suggested a compounded version.
Did you have some questions?
I had a lot of questions. I was a little nervous, but I did talk to my doctor about it a lot. And then I went and talked to the compounding pharmacy.
And it's working. She's lost about 25 pounds.
I've had just mild side effects.
Primary care provider Leanne Owens, once a skeptic herself, says she and many of her Duke Health colleagues have come around, but only in certain cases.
The thing that makes me most nervous is using unregulated compounding pharmacies that are selling the medication direct to patients without a prescription.
You worry about patients who might be buying these medications online or something.
Correct. But using a trusted provider who's using a licensed compounding pharmacy is safe.
Drug makers Novo Nordisk and Eli Lilly strongly oppose the practice. In statements to NBC News, they stressed that compounded drugs lack the same regulatory oversight as FDA-approved medicines and can pose significant safety and effectiveness risks to patients. For patients like Kenley, there's another risk.
It could be taken away tomorrow. If there's no longer a shortage, then we wouldn't be able to access this medication through the compounding pharmacy, which is scary.
Because there's no other option.
There are no other options, and this option clearly works for people. It's life-changing.